The vision here is one electronic system for eReferral in the province. From the specialist perspective, there are big advantages here. This is at one central place where you can declare what are the types of patients that you see, what's the referral area that you accept from, what's the appropriate patients to send to me so that I'm not getting deluged with referrals that are maybe not right for me. It helps me to kind of manage that. So this is the backbone, really. This is the health map. This is where all the directory listings are. As of today, if a family doc goes in or anybody in the community wants to refer, I'm just going to search HHS now just for fun. And here's all of our listings that have come up. There's a lot of specialists and a lot of physicians on here that are waiting to receive referrals. All of our specialists are busy. They're all busy. They've all got wait lists. They all want those wait lists to be shorter. This is a way for us to drive that down and get the right patients to the right people quicker.